everyone, and welcome to today's coronavirus press briefing. I'm Donna Bush. I'm so glad you could join us via our channels as well as on Radio Cayman. We go first to today's prayer by Reverend Joseph Kirkconnell.
Good afternoon. My name is Father Joseph Kirkconnell, and I am from Cayman, but I'm currently serving in the U.S. I attended St. Ignatius my whole life until going off to university. So I was asked to lead us in prayer, and so let us pray. Heavenly Father, we thank you for your mercy, for your love, for your goodness. We ask you to continue to watch over our islands, to watch over our people, your beloved sons and daughters. We pray for all those who are anxious or afraid, that you may give them faith and trust and peace. We pray for all those who feel alone, who feel isolated, who are tempted to despair. Please give them hope. We pray for all those who are sick, especially those who have COVID-19, but any illness, Lord, we ask for complete healing in the name of Jesus, and that they may be very aware of your presence, of your tender love, of your gaze upon them, that you never leave or abandon them. And we ask you to bless our leaders, give them wisdom and discernment in all the important decisions they have to make. And so, Lord, we just ask you to renew the face of the earth, to renew our country, to renew our hearts by a new outpouring of your Holy Spirit, a new Pentecost. We ask this in Jesus' name. Amen.
And thank you, Father Kirkconnell. With us in studio today, we'd like to welcome our panelists, the esteemed panelists, His Excellency the Governor, as well as the Honourable Premier and the Minister of Health. Joining us in studio are the Chief Medical Officer, the Director of HMCI, as well as our sign language interpreter. Joining us on Zoom are members of the media and Dr. Samuel Williams Rodriguez, Medical Officer of Health at the HSA. We go first to Dr. Lee.
Good afternoon. I never really know when to give you the figures, because I know that's the only reason you really listen. So I'm going to give them at the front of this rather than later on, but I have a lot to say today, so I hope you'll bear with me. There were 5 new cases of COVID out of 690 screening tests, so a total of 690 tests, and 5 were positive, of which all are assumed to be locally acquired, and contact tracing is going on. That brings the total number of people who have been positive in Cayman for COVID-19 or SARS-CoV-2 to 176, with 3 on Cayman Brac. 1 of these is symptomatic, 70 are asymptomatic, none are admitted, and 104 have recovered. For the people in isolation, there are 44 in the government facilities, 289 in isolation in their households. And in the flu clinic, there were 9 seen over the weekend, and there were 27 flu hotline calls, of which only 3 were flu-related. A bit more detail about Cayman Brac. As we've mentioned, they've now done 1,019 swabs, which represent 900 different people. Some of the screening has been on healthcare workers, and as you know, that's an ongoing program to make sure that they're clear. So 45% of the population have now been screened, and as you know, of that screening, only 2 have come up positive, and they were reported many weeks ago. The total number of tests we've done now is 15,423. There's been a fair amount of conversation amongst the scientific media about the amount of viral load that people have and what that might signify. And we're getting increasing amounts of information, as we are getting, on a lot of different aspects of SARS-CoV-2. Although some reports say that you can't culture virus, which means you cannot grow virus in the laboratory, and by inference that means that could infect somebody. You can't grow virus if your viral counts are not significantly high enough. In fact, there have been other reports recently in unpublished data saying that quite low viral counts can still potentially cause infection. You'll recall that many of the viral counts that we're seeing in Cayman are relatively low, but that is a cautionary note for us that some of those still may be able to transmit infection. But we are learning a lot all the time. It's great to know that we have a licensed antiviral therapy now, so we are increasing our knowledge both about the disease itself, how to manage it, and hopefully at some point with a vaccine. There's been a lot in the news to address, and I've had a number of different questions about the news. On the 5th of June, the World Health Organization released an updated information pamphlet, a piece of guidance about the use of masks, advising that masks should be used where there is active spread. And there were about 3 paragraphs in that document talking about asymptomatic and pre-symptomatic spread, which is why it was with surprise that many people in the scientific community and beyond heard Dr. Maria Vankakova in her remarks yesterday talking about asymptomatic and pre-symptomatic spread. However, I have noticed that she has stepped back a little bit from what she said and have stated that her comments were not WHO policy at the time. 2 recent papers in the very respected, highly respected journal Nature have talked about the lockdown effects that have been instituted worldwide and have demonstrated quite clearly and with nice little moving graphics how the lockdown in a number of countries around the world managed to flatten off almost immediately the rate of infection and therefore save major outbreaks. So that is evidence for us all. But these very same papers have also cautioned us that as the lockdowns are lifted, we are likely to see more infections rise around the world. So far, time has been the most expensive thing that we've bought, and many of us have painfully felt that. I very much appreciate that. But that time has allowed the virus in Cayman to burn itself out in the relatively healthy communities that we're finding it in and amongst the people who are relatively young. So I thank you very much for your perseverance. That time has really helped us protect the people of Cayman, particularly our most vulnerable. And as you recall, we are still getting positives, and positives which I feel reflect some concern. But we're making great progress. The new norm will continue to be social distancing, trying to work from home where possible, reducing the density in all places, including in offices, and wearing masks. And in particular, of all of the things we do, hand hygiene is possibly the most important. So please don't forget that hand hygiene, which accompanies, of course, respiratory etiquette, masks, and the distancing. But having said all of that, it's going to be not very long at all before churches will be able to open, home care will be going back, sports will be able to restart. And so we all have that on the horizon, and I'm really pleased that that is just a little way away and will be there very soon. And I'm sure the government will be announcing that in due course, provided that the figures remain as they are, encouragingly low and encouragingly with nobody very sick being required to be admitted to hospital.
Okay, thank you very much. Dr. Lee, we do have a question for you from April Cummings at Radio Cayman. April, please go ahead.
Thank you, Donna. Dr. Lee, just quickly, you talked about a moment ago, I just want to make sure I heard you correctly. You were saying we had a licensed antiviral therapy. Could you just speak to that a little bit for those of us who missed that part?
Yes, I'd probably, there is not us, but the world, I understand there's one of the antiviral therapies has now been licensed for use in COVID I read. I would have to go back and refresh my memory to give you all of the details of that, April, but I can provide that for you if you'd like.
Thank you very much. I wanted to make sure I'd heard correctly. My other question relates to some of the concerns people have messaged me over as we open up. There are folks who are nervous about seeing how many people are out and about right now and express concerns about perhaps not enough social distancing in some of the restaurants and stuff over the past couple of days. Have you yourself been out and about, and what have you seen, and how are you feeling about all that?
I really would encourage people to continue their social distancing. It really, although we may well be in a good position in Cayman. We don't know if there will be an outbreak. That's the concern. We don't know if one of these cases that keep coming up as positive will not be detected and will start a flare-up of COVID-19. We're in a much better position to tackle that now. We are fully prepared. Our PPE levels are high. We have an amazing field hospital. We've worked really hard to get prepared for a major outbreak. But it is in everybody's own interest to maintain the distancing, to maintain the hand hygiene, to wear masks, continue with the respiratory etiquette, and when you go back to work, to continue to keep the densities down, because if there is an outbreak, then that is what is going to protect you. We've also previously talked about being in certain social groups, so try to stick to certain social groups, because that again will protect you. In the longer term, if we get to a state where we have a vaccine, which of course we all desperately want, then we may be able to go back to our old norm. But at the moment, the new norm is to protect yourself and to protect your loved ones and also the community. But you could just be selfish and think of yourself and the people around you, or you could think of the whole community. But whichever you do, please do protect yourselves.
And finally, Dr. Lee, I'm sorry to take up so much of your time. There have been some rumors going around about people with masks either having trouble breathing, and some rumors about, I couldn't tell if it was carbon dioxide or carbon monoxide toxicity. Is there any truth to any of that, and could you address that for us?
It's difficult for me to address a rumor, not something I'd like to do. Certainly I can say that, of course, surgical masks are worn by surgeons for hours and hours and hours a day whilst they are doing very meticulous surgery, and it's not an issue. Carbon dioxide moves away from the body very easily with each breath. I think I would not recommend anybody from entertaining exercise with a mask. I don't think that's a sensible thing to do. But if you're resting quietly, going about your normal business with a mask, doing your shopping, whatever, I don't think there should be an issue with that. I recognize there has been some concern, but it does not really give me cause for concern. And the issue is not carbon monoxide, it's carbon dioxide.
I was afraid you'd say that. Thank you, Dr. Lee. I appreciate it.
Thank you very much, April. Dr. Lee, before we go to Wendy at CNS, I have a few questions from the public. The first one relates to frontline workers being tested. With the huge numbers of people who've been tested, have all healthcare workers been tested? Those that work in the older people's homes, those who work in the hospitals, are all front healthcare workers?
As far as I'm aware, yes, and actually a lot of them have been tested multiple times now.
Yeah, I would imagine so. Okay, thank you. The other question is, how do we know that the results that we're getting, and I know you've mentioned this before, but just for clarity, how do we know that the results that we're getting are not false negatives or positive?
I think you're basically asking about the quality assurance of any laboratory. And so we've previously talked about sending results to CARPHA as a quality assurance, but the best people to talk about this would be people from the labs, and if you really wanted, I'm sure they'd be delighted to talk for a long time about the quality assurance process that they have in place. But they're both internal controls, so they do controls on the samples themselves by having test samples go through. They regularly, as we know, shut down the machines and again go through test samples. When there's a new machine or a new reagent come, they go through another set of tests. So there are internal things. There are also external controls. So, for example, the Health Services Authority has contributed to a WHO program to validate their results, where they get sent some surprise results and then they have to provide their answers. I don't know what the answer to that is. We haven't had the results back on that.
Okay.
And also laboratories share information. So there's information being shared between Doctors Hospital and the Health Services Authority on their lab. So there's lots of internal and external controls, both which happen on an every test basis as well as more planned programs. And both of the labs providing PCR, or all of the labs providing all of their services, do this for all of their procedures and processes.
Okay, thank you very much. We're going to go now to Wendy from CNS. Wendy, please go ahead. Okay, I think Ralph from Caymanian Times is standing by. We'll go to him and come back to Wendy. Ralph, please go ahead.
Yes. Thank you. And good afternoon, Doctor. I hope you had a great weekend, and
Good
thank you for that report. Actually, you answered most of my questions, particularly with that WHO update. But one question I have for you, as some of our business owners, particularly in the hairdressing and salon industries, get ready to reopen, can you give us an idea of what the protocols will look like?
Unfortunately, we're not able to provide protocols for every business that's returning to work. There is a lot of information that's been produced from the government about going back to work because their general principles apply to all groups. As far as industry-specific information is concerned, we are asking that everybody would look to their industry leaders. As far as the hairdressing is concerned, for example, I did a quick check yesterday about whether I could find out some information, and pretty quickly had followed a link from the UK government. It wasn't a health website, clearly, because that's not a health issue, hairdressing. But I followed a link from a UK government website and got immediately to one of their recommended sites, which had protocols and guidelines about what to do for returning to work. So whether it's hairdressing or any other industry, I would recommend that you look to international sites, because for larger companies, they have larger countries, they have the resources to be able to produce these from industry groups and so on.
Thank you.
Okay, thank you, Ralph. We go now to Wendy from CNS. Wendy, please go ahead.
Thanks, Donna. I just have two quick questions for Dr. Lee. Just to clarify the question that April asked earlier, can he just confirm, as we've had several people suggest that this has happened, that the hospital has had several cases of people checking in that are really sick because they've been wearing face masks? Can he confirm that that is not the case and that we have had no patients checked into the hospital because they've been poisoning themselves from wearing masks? Because it is spreading on social media and therefore scaring
Dr.
people.
Williamson? Yeah.
Okay. Wendy, we're going to go to Dr. Samuel Williams Rodriguez.
Okay, thank you.
For an answer to that question. Dr. Sam?
Hi, good afternoon. Yeah, we are not aware of that large amount of patients attending the hospital with shortness of breath.
Dr. Sam, we're not hearing you right now. I believe that your connection is giving some issues. You could either try moving from where you are or restart your answer, please. Okay, I think we may have lost him there, Wendy. We'll come back to Dr. Samuel Williams. Wendy, do you have any other questions?
Okay. Yes, I just have another follow-up for Dr. Lee as well regarding the contact tracing here. I think given the comments that were made by the WHO doctor and the fact that asymptomatic people are not necessarily transferring the virus, I think, can Dr. Lee give us the evidence here that in actual fact it has happened? Because he said on many occasions that we've contact traced and there's been people who were positive, who were tested positive for COVID, who were contacts of people who were asymptomatic. So does he have the figures for that, which would definitely help to underscore that there is asymptomatic transmission, which I think we all know here that there has been?
Yes, Wendy. I mean, that the figures that when we announced the positives every day since the end of April, all of those people that have come forward, bar possibly one, have not had symptoms. So we must assume that they've had asymptomatic, or they've had such mild symptoms that it didn't stick in their memory. That is a possibility. I think a lot of people who live strictly by the definitions will say that many people who say they have no symptoms actually have had maybe a day of incredibly mild symptoms, and they would count that. But it's very difficult for some people to remember a sniffle perhaps one day or a mild headache.
Yeah, I was just wondering whether we had the numbers of the people that were contacts of positive patients where the patient was largely asymptomatic, just to confirm that we know that there is asymptomatic spread. Because I think This WHO thing has triggered off the idea. Everyone here now thinks that that you're crazy for locking everything down because asymptomatic people can't pass it on.
Yes, so we
Whereas
have.
I think we have the evidence that it has.
People have to get it from somewhere, Wendy, and we have. In some of the people that are asymptomatic, there have been other people in the same household group or contact trace that have also been positive, yes, which is why when I say repeatedly, week after week, that there is a contact of a previous positive, as everybody, all of them have been asymptomatic, you'll understand that those other people were also asymptomatic.
Exactly. So do you have a figure for that number?
Not in my head, Wendy, no.
People.
If you're asking for whether I can give you an exact figure now, I can't, no.
Okay, cool. Can I email you and sort of request as I did before? Because I was very grateful for the figures that you gave earlier.
Yes, of course.
Thank you very much. I appreciate that. And those are all my questions for Dr. Lee. Donna, thank you.
Okay, I believe we can go back to Dr. Sam. He says that he thinks he's got it sorted now.
Okay,
so we'll
great.
go back to him for an answer to your question earlier.
Thank you.
Sam?
Hi, I'm here. I'm not sure. The internet is a little bit unstable. So we have not received a report of a large number of patients attending the emergency department due to shortness of breath for wearing the mask. And also I can confirm that only one patient so far has requested an exemption to wearing the mask through a letter through her physician. And that was granted because the patient does have a chronic medical condition that will prevent them from wearing a mask without any difficulty.
Okay, great. Thank you very much for that, Dr. Sam. Thank you.
You're welcome.
Okay, thank you, Wendy. Thank you, Dr. Lee. We're going to go now to our panel, beginning with the Honorable Premier.
Thank you, Donna. Hello, everyone. Well, I think we can all, again, continue to feel very optimistic at the results just delivered by Dr. Lee. And I want to say a bit about that. We reopened the bars and the restaurants to outdoor dining over the weekend, and indications are that that has gone quite well. This really is, I think, the key test for Cayman as to the prevalence of the virus and as to whether or not there will be a spike as a result of more people interacting with each other. We have put in place the same social or physical distancing restrictions, requirements as apply generally. I know this has caused some consternation and some frustration on the part of both proprietors as well as patrons of these establishments. But again, we are doing everything we can within reason to avoid the onward transmission of the virus. The jury is still very much out on many of these issues, and the discussion Dr. Lee just had with Wendy about the WHO announcement and then withdrawal of the announcement regarding whether or not asymptomatic persons can pass the virus on continues to be an international debate. But as Dr. Lee has said, those who are getting it from someone. And if the vast majority of persons who are testing positive in Cayman are asymptomatic, clearly they must be passing it on to someone else for it to continue to move through the community, albeit at a very, very restrained rate. Now, Dr. Lee hinted at the lifting of more restrictions in the next few weeks. We are all very optimistic that that will be possible. As everyone will probably remember, we are now in week 2 of a 3-week shelter-in-place set of orders. And as I said, over the course of these 2 weeks, which will be the 2 weeks that the restaurants and bars are reopened, at least for outdoor activities, by this by this time next week, well, I think we will have a pretty good idea whether that reopening has in any way impacted the infection rate of the virus. We're still keeping it very, very low, or I shouldn't say we're keeping it, well, perhaps we are as a result of our measures, at about 1.15%. So assuming that all goes well over the course of the next couple of weeks, we should be able to lift virtually all of the current restrictions with respect to the gatherings and with respect to what I call the touch services of, medical doctors, medical clinics, for purposes other than just emergency, as is currently the case, and hair salons and so forth being able to reopen. We should also be able to begin to allow domestic help and child caregivers generally, back into the homes. And I know this is a big issue for many, many people, to allow, again, children to have access to playgrounds and to interaction with each other. We are only just about beginning to focus very seriously on what those new restrictions, what those new arrangements, not call them restrictions anymore, let me put that word behind us, what the new arrangements will be like, because there will have to continue to be a some sort of shelter in place regulations for the next little while, governing mainly behavior rather than so much where you can go and what you can do, but how you should conduct yourself in relation to the continued wearing of face masks, proper hand hygiene and respiratory etiquette, as well as the now famous or infamous physical distancing requirements. So that is the good news. Also, we will have to consider over the course of the next few days what we do with respect to travel, inter-island travel. And again, that will be done in conjunction with the representatives from Cayman Brac and Little Cayman. We have tested, I think, about 52% of Brackers, and other than the 3 cases that we have, nobody's tested positive. Everybody in Little Cayman is negative. So obviously, allowing inter-island travel from Grand Cayman is going to increase the risk of COVID being reintroduced to those 2 islands. And so that is the risk that we have to weigh in the balance, because there is an increased pressure from Brackers, many of whom have second homes, or indeed maybe even a first home in Cayman Brac and want to return there, and a 14-day quarantine before they go is, shall I say, something of an inconvenience. So those are some of the issues that we will have to grapple with over the course of the balance of this week and early next week. And as I say, assuming that the results continue to be as good, to trend as well as they currently are, come next, well, yes, today 2 weeks. Yeah. Today 2 weeks, or yesterday 2 weeks, whichever way you look at it. We should be able to really return to pretty much normal activities in Cayman, albeit with borders that remain closed, and all of the challenges and frustration that involves. But we will work through those issues as well, as we see what happens elsewhere, and as we continue to have hope about a quick test, even though there doesn't seem to be a great deal of hope of a quick vaccine, to find ways that we can safely reopen our borders to both residents and visitors. So I wanted to say that a little bit without going into too much detail, so that everyone understands that we are making incredibly good progress. And Cayman continues to be an incredible success story with respect to the way we've managed the public health challenges involved in this involved in this epidemic. Sometimes I think we are tempted to believe that the risk has gone away. If so, just turn on your television to BBC or Al Jazeera or CNN and look at how many people are still dying all around the world as a result of this dread disease. The death toll is now well over 400,000 worldwide, and in the UK, well over 50,000. So this is still a killer disease. We have just gotten Cayman in a really, really good place. Locally, we have to now continue to focus on how we can reopen the borders without risking or creating great risks of introducing perhaps a more virulent strain of it here, and undoing all of the good that we have done so far. So I want to turn now to deal with some of the other issues that the government is grappling with, because we know this has created an economic crisis, an employment crisis for many people, and the government is continuing to work diligently to find means of improving the lives of the people who live here, and of trying to be able to give as many businesses as we can a fighting chance to survive until the tourism industry returns. So as I've said more than once, one of the great one of the big policy points that we have is to try as far as possible to leave as much money as we can in people's pockets and in businesses' bank accounts. Cash flow is a huge issue for many businesses. And so we had cabinet today. We've issued a directive which has been executed by the Deputy Governor in the form of a memorandum to all departments and ministries that every government entity should process all invoices and refunds received from businesses with absolute haste. In other words, let's pay our bills as quickly as we possibly can. If government owes businesses or individuals money, refund it as swiftly as you possibly can, because cash flow is a major issue. Within my own area of responsibility, work and CBC have been directed to process their backlog of refunds within 14 days. Some examples. Since January, Works Accounts team have processed some 1,183 refunds due to refused, withdrawn, or canceled permits, with a marked increase in cancellations since March. Work is deploying additional resources to process the remaining 924 refunds within the next 14 days. We've also been made aware that issues with work permits expiring during the shelter-in-place orders have created operational issues and legal issues for businesses and for work permit holders. The government has taken a number of actions recently, last week and again this week, so that employers whose work permits expired since the shelter-in-place orders came into force on the 27th of March are now required to apply for renewal by 30th of June to be in compliance with the law. The original deadline for employers of 31st of May has been extended following consultation with private sector stakeholders, including the Chamber of Commerce. And there is also an issue with respect to temporary work permits. And so the government has issued a directive to the Director of Work to extend the validity period of temporary work permits held by construction companies and by small and micro businesses, domestic helpers and caregivers for a period of 10 weeks. This is to reflect the time lost during the shelter-in-place order. This applies to work permits that were valid as of the 27th of March, 2020. So essentially what we are doing, if I can summarize it, is we're giving businesses back credit for the time they have lost. So they've had a work permit for someone, a temporary work permit for someone. The individual was not able to work because of the shelter-in-place provisions. We're giving you credit back for that time. So you get an extra 10 weeks. So we hope these measures will assist businesses as we all collectively try to work through the challenges that the current pandemic has placed the country in. I should also say that the government continues to work on measures aimed at assisting businesses. Many small businesses and some not so small are really struggling with cash flow and the ability to get through this. And the government is working assiduously now on a scheme which we believe will be able to assist many businesses in a significant way by allowing them access to significant funds during this very difficult period. I don't want to say any more than that right now because it's still in the very early stages, but I just want to ensure everyone to be assured that the government is now that the public health threat appears to have receded or to be receding, firmly focused on what we can do to improve the economic health of businesses, individuals, and the country as a whole. Thank you, Donna.
Thank you very much, Premier McLaughlin, Your Excellency.
Yes, thank you very much, Donna. Good afternoon, everyone. It's good to be back with you again. I first just want to make a brief comment about the test results. We've had another almost 700 today. So I think HSA, Doctors Hospital, supported by Health City, are doing a truly magnificent job in terms of the volume of tests that they are doing. And we've now done over 15,000. That's almost a quarter of our population. And I think we're up to fourth in the world in terms of the number of tests per capita. So we should all be very proud of what we're achieving on the test results. And as the Premier said, I think we're all feeling a real sense of optimism about where we are in tackling this virus, and the cases, or the positive cases we're getting, don't cause us great concern at the moment. I mean, I believe that one sort of great feature of this pandemic is the sort of uncertainty around the science. We've had a perfect example of that today. Dr. Lee talking about the question of viral load and how infectious asymptomatic people are, and then the WHO one day saying it's very rare to be infectious if you're asymptomatic, and the next day rowing back. So I think all of that simply underlines that our approach of being cautious, taking very gradual, carefully thought through measures is absolutely the right one to adopt. But as the Premier said, we are now getting very close to the point at which we'll be able to ease many of the restrictions. And that is, of course, very welcome as we get to the next point around about the 21st of June. But I just want to reiterate what Dr. Lee has said, and the Premier as well, that this really, as we move from here onwards, is about our behaviours. And we really do need to remain disciplined about social distancing, basic hygiene, and wearing masks in public. And that, as more and more people have interactions with others, as we ease restrictions, that is really, really important. So I want to just make a few comments on evacuation flights. Let me first of all just reiterate that my office remains the lead in terms of negotiating with foreign governments for organising evacuation flights, and my office will remain in the lead on organising BA flights. But the Ministry of Employment and Border Control is now in the lead on people returning to the islands and decisions on that, and we're transitioning into that new process at the present time. So everything is on course for the British Airways flight at the end of this week. It will be full in both directions, although there are a very small number of seats outward if people still want to go. And as I've said before, that flight will go to Turks and Caicos first and then come to Grand Cayman. And it's taking a large number of people to Turks and Caicos who will then go on to Bahamas and BVI. We remain in very close discussion with India about the 2 flights there, and I think we are getting there, but there is just a final negotiation around the personal protection equipment needed by the BA crews on those flights. But we are very close to an agreement, and I know the Indian community is very keen to see those flights confirmed, and I hope we can confirm those soon. And Cayman Airways have asked me to point out that there are 2 further flights to Jamaica this Wednesday and Friday. All the arrangements for those flights are being handled by the Jamaican consulate here in terms of who goes back on those. The Deputy Governor has asked me to make a statement about the civil service and re-entry of the civil service. So throughout this pandemic, the civil service has seamlessly delivered essential services by adapting its ways of working to ensure the continued safety of our staff and the public. For the vast majority of departments, it has been possible to provide a wide array of normal business services by instituting flexible working practices, embracing technology and quickly mobilising innovative approaches to delivering services. And essential services, including those which required a physical presence, were maintained and even enhanced throughout the crisis. However, with the risk of community spread when it was at its highest, non-essential services which could not be delivered remotely were suspended until it was safe to resume those services in person. So as a result of the very effective measures that the government has adopted and implemented by the public sector, working with civil society and the responsible actions of all of you in the public, we have made great strides to contain this virus, and the civil service is therefore preparing to get back to full force by also delivering those normal business services which require a physical presence by staff for customers. So the civil service is working on a plan to resume normal activities, provided that the services themselves are deemed to be safe activities. The Deputy Governor is meeting with chief officers and heads of department this Friday to finalise this plan, and we will be aiming to bring government services back to full operations. But as we do that, it is envisaged that the civil service will continue, wherever possible, to deliver services through remote working and will additionally return employees to the workplace where the service requires a physical presence in order to be delivered. So we'll give further information following Friday's meeting, and civil servants will be notified by their respective department. But a lot of work going on behind the scenes by the civil service to get in the right place for the next phase of our measures. And then finally, today, I just wanted to note that next Monday is, of course, a public holiday. It's the Queen's birthday. I think you all know the Queen has 2 birthdays, one in April, which is her actual birthday, but it has become the tradition to celebrate her birthday in the summer. Of course, this year we won't be able to organise the parade that we normally do, and we won't be able to organise a reception at Government House. And that's all very sad, and it's probably the first time probably in living memory that we've not been able to do that in the islands. But I just want to say that, as Her Majesty herself has said, and she captures the mood so poignantly so often, that we will meet again, but for reasons that everyone understands, we won't be doing that for this year's Queen's birthday celebrations. Thank you.
Thank you, Your Excellency. Minister of Health.
Thank you, Donna. Good afternoon, everyone. Grand Cayman, Cayman Brac, Little Cayman, and our Cayman diaspora listening in. I know it's been said that anything you can do for 30 days, you can do for the rest of your life. But with this,
30.
with this, but this last 3 months seemed like a lifetime. The difference is that our freedom, we had little freedom, and it was impeded, and most jobs were halted. No, the thing about it is that no one is really a specialist on COVID-19, and as you heard, every day is something new, something being learned about this disease. And when the COVID-19 started back in March of this year, for the first 3 weeks, I got emails and messages about how proud people were to be Caymanian, and how we were doing such a fantastic job. But now people are getting weary, and we understand it. But they're getting weary about what has worked. And in our estimations, and we've not lost one Caymanian life, and that was our goal to COVID-19, thank God. We are asking for some patience and just a little bit more. We don't just pick these ideas out of the sky. We consult with the CMO, Cayman Islands Public Health England, CARFA, etc. Thank God we did what we did when we did, and most appreciate what we did. And we get the calls and messages about some of the measures that we took back then on March 22nd. If we didn't respond, we would be called out, like how the World Health Organization has called out places like Tanzania for their lackluster response and not doing enough to stop the spread. We know it's different from what we used to and the freedom we are accustomed to, and we want normalcy back, but very little in the world is normal right now, sadly so. And most are doing what we are doing. And so even if we released everything normal locally, we still have the challenge of waiting to see what other countries are doing with their challenges in terms of opening back their borders. And we are fortunate enough to be able to assist in the way we have after this COVID-19, during this COVID-19, because of the way that we handle our finances over the past 3 years and before. And we are seeing a lot on the news and overseas. I know everybody's looking at the TV and reading, going online. But the real stories are not being told. We're trying to do the best that we can here in the Cayman Islands to ensure that we don't put our guards down. Sometimes you can put your guard down too early and get blindsided. So I know it's uncomfortable for some. Some people want the churches open. I definitely want to go back to church. You know, I feel it in my bones. I need to get back there. We need to find a safe way, whether that's a plan. Two types of different plans. You could have an inside plan, an outside plan, you know. But we need to do everything that we do safely, because some of these things are going to be here for a while, because until we find a vaccine. Some are concerned about bars being open, restaurants being open, and not churches. That is a very valid concern. There's reasons behind why we did what we did. And we ask you all to just trust us for now. And it won't be long before some of these entities are back open again, whether that's salons and barbershops, etc. You have been very patient, and we thank you for your patience. Today's scripture reading is from Exodus 15:13. You kept your promise. You rescued the people you promised to redeem. In your strength, you will guide them to the promised land. Today's shout out goes to Meals on Wheels. Thank you for the amazing job that you guys are doing. A lot of people are made happy when you show up at their doors on a daily basis. Thank you. I say, with all that's going on, let's be thankful for all things that we have currently. Remember, if you look at what you have in life, you will always have more. If you look at what you don't have in life, you'll never have enough. Oprah. It seems I say this often, but the pandemic truly has taken the world into unfamiliar waters. And with the uncertainty, fear, and the economic downfall, and having to adjust to such drastic changes, it is understandable that many persons, particularly parents, are left feeling overwhelmed. We also want you to know that we fully understand that our children are impacted and many are struggling to make sense out of it all, but no means are we suggesting that kids are at fault here by keeping them separated out of schools with all public health matters considered. This decision still really comes from a place of love. As we all know, even with a common cold, children in their innocence tend to be the biggest spreaders. In this case, however, we are not dealing with a common cold. We are dealing with something that could take the lives of our children, as we have not seen it happen as we have seen it happen in so many countries. I'll never forget the state of Illinois in such mourning on the day that the first infant died there from COVID-19. We absolutely refuse to have that happen here. I wanted to share with you today, in case you haven't attended as yet, the Family Resource Center has been hosting parenting webinars and will host its 7th webinar in its COVID-19 parenting campaign tomorrow. These weekly facilitator-led sessions in Zoom cover topics giving support, resources, and guidance on many challenges parents and caregivers face in supporting children during these difficult times. Participants are encouraged to air their concerns and observations during the question and answer segment of each session, and so far the webinars have attracted around 65 people each Wednesday. Given the positive feedback, the Family Resource Center will continue holding the webinars until the 29th of July. This week's topic is parenting your infant during COVID-19, which is the first in a series of this particular topic. Guest presenters will be experts from the Early Childhood Care and Education Unit. You can find information on how to register for these webinars on the Family Resource Center Facebook page, www.facebook.com/Family Resource Center. Future topics will focus on supporting parents with budgeting during COVID-19 and how to promote healthy digital use. The webinars are being held thanks to the ongoing collaboration of experts from both public and private sectors, including staff from the Ministry of Education, the Department of Education, and the Wellness Center. Today, I'm also pleased to announce that my ministry will be hosting the Mental Health Symposium tomorrow, Wednesday, 10th of June. I want you all to email your questions to donna.bush@gov.ky. That's for the Mental Health Symposium tomorrow, Wednesday, 10th of June. Please email your questions to donna.bush@gov.ky. We have a dynamic lineup of panelists, including Dr. Mark Lockhart, Chair of the Mental Health Commission, who will cover an overview of mental health during the COVID-19 pandemic, as well as dealing with grief during this very difficult time. Also on the panel is Dr. Earl Robinson, who is a consultant pediatrician. Dr. Robertson will discuss the impact of COVID-19 pandemic on children and adolescents. And Dr. Erica Lamb, clinical psychologist, will dig into coping with stress and anxiety during COVID-19 and cover basic psychological skills and developmental stages in children and the challenges posed while out of school. We'll also have a featured guest, Dr. David Dewson, who is a COVID-19 survivor, who will share his story with all of us. The YouTube link will be shared by noon tomorrow, and I will announce the broadcast dates on CIG TV later this week. We know the symposium will be very helpful to many of us, and I want to thank my team at the Ministry and GIS for all the hard work to ensure we make this happen. Of course, a huge thank you to the doctors who have so willingly come forward to help our community with this initiative. Lastly, but certainly not least, yesterday was observed as World Oceans Day, a day which provides an opportunity to honor, help, protect, and conserve the ocean. Here in the Cayman Islands, the sea is an integral part of our story, our history, our culture, our way of life. All tie us into the sea. For most Caymanians, that connection is deep in our souls. I know that for many people on these islands, the inability to get to the sea during the COVID-19 curfew was difficult. We are therefore pleased to have been able to safely reopen the beaches for swimming and ocean for fishing. During this period, the Department of Environmental's conservation officers have been on marine and coastal patrol every day to ensure that our precious marine resources are protected. As I have previously announced, the government is committed to enacting new regulations to give effect to the proposals for enhanced marine parks, which were developed by the Department of Environment and the National Conservation Council, as well as considering the NCC's proposal for the protection of mangroves, which play a vitally important role in the health and prosperity of our near-shore and ocean marine stocks. So today I thank the Department of Environment, especially their conservation officers, for the work they do every day to protect and conserve our marine resources. I also wish to thank all law-abiding citizens and partnering with us in these efforts, thus ensuring that the Cayman Islands can celebrate World Ocean Day with a sustainable marine future ahead of us. Let us be conscious of the importance of our oceans today and every day. I thank you, and God bless.
Thank you very much.
I Donna,
Premier.
can I just mention one more point, which is probably going to come up in a question anyhow. I mentioned on Friday that the deadline had been extended to 11:59 p.m. on Sunday, the 7th of June, for displaced Caymanian tourism employees to register with the Ministry of Tourism. Registration had been open from May 21st. And the Minister of Tourism has now confirmed receipt of more than 2,700 submissions. So my little announcement on Friday had its intended and desired effect.
Thank you. Okay, we're going to open up the questions from the media, beginning with April from Radio Cayman. April, please go ahead.
Thank you, Donna. Mr. Premier, this one is for you. The pandemic, from my perspective, has shown where we're vulnerable economically, right? So tourism gets shut down because we can't have the traffic in and out. And there's sort of this threat to the financial services sector because of the blacklisting and the potential problems there. Is there anyone in the team of government and the party, for that matter, working on alternatives to sort of bolster our economy so that we have some other options to kind of even things out?
Well, we've been concentrating on broadening the base of our economy for a significant number of years. But the reality is that virtually everything that we do requires some level of inward investment or traffic or something, because we provide services. As an example, so we pushed forward with the idea which had come about during the previous administration led by the Honorable McKeever Bush, with the development of Health City. And as we saw that, all of us on both sides of the House at the time, as a way to create another limb to the tourism industry, one which we felt was more reliable than leisure tourism, because the theory went that people get sick in good times and in bad. And so you would have a constant, reliable source of medical tourism activity, as well as the provision of the medical services. Well, lo and behold, this pandemic proved that theory very vulnerable, in the sense that that still requires people to come into your country. So financial services actually is proving to be far more resilient than many other, even though that too requires the demand for international financial services. And even though we are on the EU blacklist and we're dealing with that challenge, as well as challenges around the anti-money laundering and counter-terrorism financing rules set out by the FATF and CFATF, the industry still continues to do really well. Now, in terms of local industries, development and construction, many people say is another limb to, or another industry, and another limb or another pillar of our economy. But again, the reality is that is driven in large part by the inward flow of people, either as residents, as work permit holders, or visitors. Because without that inward flow of people, the demand for the places that are being built would not be anywhere near as great. So I think the lesson, the short lesson from all of this, is that this is a very interconnected, interreliant world in which we live, and that it is impossible to succeed, certainly in a place as small as Cayman, with as limited natural resources that we have, which would allow things like manufacturing and factories and that sort of stuff. God forbid, my own view. But without that basis, and with a population as small as ours is, it really is not possible to have a successful and prosperous economy and population without inward investment and the inward flow of people.
So, Mr. Premier, that helps a bit. Just a quick follow-up really has to do with alternatives that we were kind of exploring, like the tech city type ideas. But those all seem to still be in their early stages, not enough certainly to replace a huge chunk of the economy here. Is that correct?
Yes, and again, they all would require all of the same things that I've just spoken about. Initially, they will require the importation of the sort of high-level technical skills, and therefore other people, coming into Cayman to help do them. And of course, we are not providing those services or those products, as the case may be, for consumption locally. So again, we need to be able to have access to international markets to be able to succeed there as well. So all of these things help in terms of broadening the base of our economy. But the reality, as I think all around the world are seeing, the world in which we live now more so than ever before, has such a high level of interconnectedness and reliance on demand for the goods and the services and the products you produce, that when you have a global pandemic such as is the case now, it seriously and negatively impacts every country.
Thank you very much, sir. I appreciate that.
Okay, thank you, April. We're going to go now to Wendy at CNS. Wendy?
Thank you, Donna. My first question, I think, is probably for the governor, actually. Is it possible for us to get a tally of the people that have come and gone over the last few weeks on Friday so that we can try and perhaps work out what the population might be now?
Yeah, certainly, Wendy, we can do that. I think I did give the figures last week, so it's fairly easy to update. I mean, I think with the BA flight on Friday, it's certainly well above 1,500 who have departed, and the numbers coming in are in the sort of low hundreds. But we'll get the exact figures for Friday.
Thanks, Governor. I appreciate it. Also, I think is Danny there today?
Yes,
She sure
From
is.
Health Management. Okay, can I just check about the isolation facilities? Because we've had a couple of people say that they're trying to organise people coming back, and they've been told that the people can't come back because there's no room in quarantine. But I heard Dr. Lee say earlier that there's only 49 people in the facility. So I just wanted to check with Danny that there is no problem, and that therefore, if people are being refused, it's just some kind of confusion, presumably.
Thank you very much, Wendy. I do actually have the figures for people out and in. I have 1,765 people out and 494 people in. Now, in my figures I've got here from the NEAC is 35 people currently in the isolation facility. The facility itself can house about 160 people at the main one we're using. However, again, we are trying to rotate flights. So, of course, we have a flight coming in for BA, bridge flight, as well as Miami and so forth. So we're going to make sure that we can rotate them so each country gets a sort of fair rotation. Obviously, Caymanians do get the priority of coming in, as well as PR holders, and work permit holders would be the in line. But again, Caymanians have to have the priority. We are looking at alternative sites. We have found one. There are a lot of logistics that go into organising an isolation facility. However, that is very much work in progress, and we are, making sure we can accommodate those people coming in. We do know that there's obviously a lot of people who want to get home, and we really appreciate, again, their patience for one, but also, there is, as I say, lots of logistics that go into it. But yeah, I mean, some more rooms will be coming online very, very soon.
Okay, great. Thank you. I appreciate that. The other question I have, my remaining questions are all for the Premier, I think. The first one, and I'm not sure whether he'd be able to answer it or whether we might be able to find out from work, but we've had a few concerns raised with us about people who have tested positive, who are in isolation, and their bosses are not paying them. I know many companies have been paying staff that have tested positive and have put out press releases about supporting them. But is there a requirement in law for people to be paid if they have to be isolated because they tested positive, because it's effectively sick leave?
Yes, that's right. It's effectively sick leave. So the usual sick leave requirements as a matter of law would apply, but in these particular circumstances that everybody's dealing with, I would expect that there should be some further time afforded employers on a compassionate basis.
Okay, so anybody that's not being paid, that's in isolation, they should really contact the Department of Labour.
Yes, that's clearly sick leave.
Yeah. Okay, that's what I thought. Okay, the other two questions are, there has been a little bit of backlash about what people say is that government is favouring the tourism sector in terms of the money that's been dished out and the support and help. And there's a lot of people who say, well, I've been laid off or furloughed from a different type of industry and I'm getting absolutely nothing, and I'm going to the NAU and they're not helping and they're not responding. So I just wonder whether you could speak to that situation of those that are not tourism, not financial services, and are sort of hanging out on a limb with no job.
Well, first thing I want to address is your sort of throwaway observation that NAU is not helping anyone. I don't have the numbers in front of me, but as of yesterday, there were more than 10,000 people that NAU is helping by one means or another. So it's just simply unfair and inaccurate to make that statement when I have on 3 occasions provided the numbers of people that NAU consistently helps, not just through this crisis, but generally. Now, the policy decision by the government about tourism has crashed. There is nothing happening in tourism save at the moment, save for the restaurants and the bars who've only just been allowed to reopen, for the bars certainly, and the restaurants just for outdoor dining. So those are that is the most challenged sector. And it is only right and proper that the government should focus on trying to assist people who not only have no work, but are unlikely to have any possibility of any work unless they're able to move over to another sector. Now, the NAU arrangement is there and continues to work to assist people who are genuinely in need of assistance through this period. This is not the be-all. What is the case now is not the be-all and end-all of everything that we will do and that we are trying to do. I mentioned at the start measures that we are working on to try to provide significant financial assistance to businesses, because if businesses can't operate, they obviously can't hire anyone. So hence the focus there. Government is of limited means. We simply do not, and I've said this from the beginning, we simply cannot afford to pay salaries to every single person that has been unemployed. Even what we're doing for tourism workers, we recognize is very small in terms of the overall assistance. $1,000 a month over 3 months, while that amounts to a lot of money from government who's paying it out, does not amount to a lot of money to the tourism worker who's receiving it. So we are very conscious that we can't fix everything, but we certainly are doing everything that we can and are constantly looking at ways by which we can help to supplement what people receive. Most people should start to receive their pension withdrawals over the course of the next few weeks. I gather more than 20,000 applications have gone in. That means that a very significant part of the private sector workforce has applied for withdrawals. So that should help, depending on how much the individual has in the fund to start with. That should help as well. Meanwhile, we're driving really hard to try to get the economy, the various elements of the economy moving again. Bars, restaurants, construction. Construction has been a massive boost in terms of economic activity. And we're going to continue down this road as hopefully we get to the end of the restrictions themselves. We've pointed out, as the Minister of Finance did, that government is already going out to ensure that we have contingent financing so that we can continue to support the economy, businesses, people, and to get us through this very, very difficult time until the borders can open and hopefully tourism can start to recover. So, we're far from perfect, but believe you me, we're trying really hard.
Thank you. No, I appreciate it. It's just that a lot of people are, raising these issues. And
no, I hear them too, Wendy. I hear them too. And
Yeah,
that's
I'm
why
sure you
I
do.
thank you for the opportunity to be able to say what it is we're doing.
Okay. The other one as well, which is a similar kind of thing, which is unfortunately another criticism, is that parents are saying that you just haven't justified or listened to them in terms of the childcare problem and the lack of allowing small groups of kids to come together. So, I understand that you would have seen the petition by now that's been handed in. What are your thoughts about that at the moment?
Well, Wendy, we have been guided by the science all along. These decisions about who can gather and who can't are not my decisions. I support, as does the government and the governor, the decisions, the advice and guidance of the Chief Medical Officer and his team. That is why we have been so incredibly successful. Had we given in to every whim and fancy and demand, I think the results would be very, very different in terms of the number of people who were sick or dead as a result of this pandemic. So it's not as though we don't listen. It is that the medical advice tells us that at least for the next couple of weeks, we need to hold the line until we see what the results are as a result of this latest release of people back into circulation, particularly with respect to the bars and the restaurants, and of course last week's and the weeks before release of construction workers. So again, I just beg people to be patient, trust the course we're on. We have delivered so far, and I'm confident if we just stay on course for the next few weeks, we'll come out the other end, being able to move around in Cayman with a relative sense of safety and security, resume our social activities, our employment lives, and live in something of a bubble, approaching a bubble, while we work to find ways to be able to reopen the borders. If we wind up with a massive outbreak, it's going to change everything. We are trying to avoid that, and that's why Dr. Lee keeps talking about as we reopen the economy, it becomes more and more a personal responsibility of each of us, and particularly parents, to limit the interaction that our children have with other children and other people, so that if something happens, we all know generally who those contacts were before we sort of say everything is safe, everything is fine, let's get back to life as normal. Because if an outbreak happens in those circumstances where everybody's commingling, trying to trace contacts is going to be an impossible exercise. What's saved Cayman, we believe, so far, in large part from the tragedies that have occurred in so many other places, is we've managed to protect the vulnerable and the elderly from exposure to the virus. But they are still very much at risk in the present environment. And so I say this because I see lots of noise around grandparents, children wanting to, or parents wanting their children, and children wanting to meet their grandparents, and grandparents want to meet their grandchildren. That's all understandable and very natural, but we need to be able, and parents are going to have to make those judgments to assess the risks as they increasingly, the government restrictions are going to fall away.
Okay, I appreciate that. Thanks, Mr. Premier. Donna, that's all my questions for today.
Okay, thank you very much, Wendy. I do have a few questions quickly. Premier McLaughlin, places like, it's a wide range here, places like gyms, law firms, the Department of Vehicle and Driver's License. Any clue as to when these places may be considered to, they'll be able to open up?
If things continue on their present trend, probably in about 2 weeks.
Okay. We know currently those who are on work permits and coming back on those evacuation flights that would be going out have to pay a fee to be in quarantine. Any idea when that may be lifted and persons that are coming back won't have to go into the isolation facilities but be able to isolate at home and not incur that cost?
Well, this is the big question, right? Because we don't believe that self-isolation is terribly secure. I'm trying to find a nice way to say this, hence my hesitation. It is one thing for persons who are here and who have acquired the virus locally to be required to self-isolate and their contacts. because certainly in the last couple of months, the virus has proven to be fairly mild. The symptoms, if people have them at all, be fairly mild. There is so much still unknown about this virus. There are theories about different strains of it, some more virulent than others. As I said, the current global death toll is now well over 400,000 people. We all have seen close up from the television what has happened in New York State, in particular, what's happened in Italy, what's happened in Spain, what's happened in the UK, what's happened in Sweden. So there's still so much unknown about all of this that we really do not want to risk the introduction of a possible more virulent strain to Cayman by someone who comes from another country. And that is why isolation, secure isolation of those persons continues to be so important. But we're having great challenges managing this. You heard Danny just now. Government is having challenges finding places to do it and spending the resources that are necessary to do it. But we have not yet come up with a means, nor has any country, which will be a suitable substitute for that. Because as we bring people back here from somewhere else, and they come to a Cayman which is now without any lockdown, without any restrictions, really, how long you think most people are going to stay self-isolated in their nice condo on the 7 Mile Beach? You're going to see them in Foster's and in Kirk's and at Grand Ole House and everywhere. 14 days in self-isolation. My life experience has caused me to be rather cynical about people's sense of responsibility, most people's sense of responsibility when it comes to that sort of thing. They're going to make some assessments. I don't feel bad at all. I've been here for 6 days, 7 days. I don't have any virus. I'm on the road, I'm at the beach. And none of us know what the consequence of that is going to be. I'm not being categorical, I'm just saying that these are the things that we constantly talking about, the governor, myself, the cabinet, Dr. Lee. We're really trying to figure out how best to manage this. But all of us know and acknowledge that that is the greatest threat to undoing all that we have managed to do at massive sacrifice to get Cayman to where it is.
Okay, sir. Any update on small business grants? I know there was a loan that was being offered. I know you mentioned earlier that there's some plans in the works, but at present there's the small business grants. Do you have any inclination as how that process is going?
I don't have those numbers, but we can have those Friday. How much of that has been taken up and how much has not? I don't have that in my head, no.
Okay. Thank you, Premier McLaughlin. We're going to go now to Kayla at Compass. Kayla?
Hi, I just have a couple of questions. Most of them have been answered by this point. I just wanted to get a quick clarification on the restaurant and public gathering regulations. We've observed that different businesses are interpreting the regulations differently. Some allow bookings with friends from different households. Some aren't allowing those bookings and advising that going to a table with someone from a different household is a soft curfew violation. Can you just provide a clarification of what's allowed there?
Well, this is astounding. Every single facility that reopened on Sunday has been inspected by a team that physically went out and went through the regs with the proprietors and the managers there, provided guidelines, saw that the tables were properly distanced and chairs were properly distanced, and left a flyer saying what the rules are. So that's why I say this is astounding. But if people are from the same household, there is no need for the social distancing rules of 6 feet between people, because you're all living together already. Whatever one has, the rest are all already likely to have in any event, right? So So families, the social distancing rules don't apply. The rules apply for persons who are not members of the same household. Hence, the requirement that they sit 6 feet apart.
Okay. And would it be permitted for an individual, if they have an outdoor patio, to have friends over to that outdoor patio and sit 6 feet apart at their own property?
Currently, no.
Okay.
In a couple of
Thank you.
weeks, ask me again.
All right. Yeah, I just wanted to clear that up. And my last question is about education. I understand that on Friday, we're expecting a inspection report to be released about how remote learning has gone in public schools. Do we have an idea about what has been found through that inspection and how the inspection was carried out?
I wouldn't want to spoil the surprise for Friday.
I thought you might say that. Okay.
Though truthfully, I don't know. I haven't seen the report myself.
All right. All right. We'll hold off for Friday then. And do we have any indication if we might be hearing from the Ministry or Department of Education that day?
I'm sure they will. I haven't had it in direct indication, but I'm sure they will. If the report is going to be out there, someone's going to want to or someone's going to need to be able to explain it or answer questions about it. So
right.
I'll speak to them. If it's not Friday, it'll be the following Tuesday. I don't think we have anything pressing at the moment that we know about for Friday, so we can happily give the space at this point. But today's only Tuesday, so we'll see.
All right, perfect. That's all for me. Thank you.
Okay.
Thank you very much, Kayla. We finally go to Ralph from Caymanian Times.
Good afternoon, Mr. Premier, and my question is just for you today, as we get close to wrapping up. It's on the topic of food security. As a farmer yourself, I know this is probably close to your heart. We have seen the cost of food increase over time and probably will continue that way, knowing what's happening in the world markets. What can be done to reduce the cost of producing food locally? And what incentives are beefed up for the farmers and so they can continue to provide a reasonable cost?
Whoa, I'm not sure you want to ask me that question, but the truth of the matter is it is generally much more expensive to produce food locally than it is to import it for most things. Because the cost of labor is so incredibly high in Cayman, and because unless you're operating a hydroponic or climate control facility, if you're operating a farm where things are grown in the ground like mine, there is a limited amount of arable land because an acre in Cayman does not give you the same kind of potential yield as an acre in Cuba or Jamaica, because we got to account for a whole lot of what Cayman is called cliff rock, generally. So you need a lot of land to be able to produce, in the sort of volumes and on this sort of scale that can make a farm really viable. Some farmers do, as I do, which is because I have a fair bit of land, plant orchards of fruit trees, and then supplement that with what we call cash crops of melons and pumpkin and cucumber and tomatoes and that sort of stuff. But the cost of production is still significant, very significant. So Cayman, the niche that Cayman farmers have carved out over the course of the last 15 years or so is quality, fresh product or produce, which people here are prepared to pay premium prices for, because it's just come from the farm. If control of costs is what you're looking for, I'm not sure local production is going to deliver that.
Thank you very much.
Thank you very much, Ralph. Any final words from my panelists? Oh, we're good. All right. We would like to thank you, the public, for joining us here today. Also to our esteemed panelists for bringing us up to date on what's happening as it relates to the coronavirus. Remember, you can go online to gov.ky/coronavirus for details on all the things that you may want to know, the latest information. We invite you to join us here again on Friday. For those of you watching, please stay tuned for today's regional and world coronavirus statistics.
Piece of engineering that enables power to be delivered to countless homes. I've been there, not round the Sizewell reactor itself, but just next door to it. The lights come on in the building I'm in, and I could sit there and think, yeah, but is there enough supply next door in Sizewell to keep my light burning? Oh, this can light up a town, a city, and more. It seems like an inexhaustible supply of this nuclear reactor. And that's like nothing compared to the mighty power of God. You see,